Alright guys, I just want to come over, go over a small topic, sorry I'm just in the camera, of people that are dating with disorders, or you have disorders, you've gone through something. And basically one thing that I want to touch home in on is that when is it appropriate to, just tell people about if you have a problem, okay? And so, there's a lot of things on that, right? So basically, if I was a guy and somebody, and this is the reason why you should give your problems out in small dosages, okay? There's a lot of people with insecurities that have a lot of health disorders, anxiety, OCD, a lot of things, bipolar, a lot, okay? Physical issues, all those types of sorts. You need to realistically give it in small dosages. I'll give you a great example why you should give these out in small dosages. And realistically, this will make sense, okay? So if I was out with a group of guys and somebody goes, "Hey, look at her rack. Okay, look at that girl's rack over there." Right? So me as a guy, I'm going to look, right? Girls, don't tell me you don't do this yourself. If you're out there with a group of girls, and you're like, check out that guy's butt, you're going to look. You can be married and you're going to look. So what I'm trying to tell you is that when you make the first thing about your disorder, when you come out and say, hey, my name's whatever, I have anxiety disorder, they're going to focus on that. And let's face it, if you're having relations with somebody, I don't mean relations as in you're having, sexual relations, just of the opposite sex. You're trying to get to know each other more, okay? So you're trying to get to know each other more, right? So basically is when you have these relations, right? So you go out on a date, opposite sex, they already like you. They already like your looks. I mean, they already like you for your looks. They like you for your personality, okay? So understand that. Understand, get past your self-doubt. And I'll get into that in a minute. But understand that. They already like you. They already like you. They already like your looks. They already like some parts of your personality, right? Or else they wouldn't be out there. They wouldn't be there with you on a date. So that's the first thing. But as those examples I gave, if you're like, well, I have anxiety disorder, right? I have anxiety disorder. That's the first thing they're going to pay attention to. Like, basically, it's almost the same as somebody going, hey, that girl has a nice rack. You're going to look, and that's what you're going to pay attention to. And that's not what they should be paying attention to. They should be paying attention to why they like you, your looks, and your personality. Okay? Right? So many people have so many insecurities that, bipolar in particular, anxiety, OCD, physical ailments, and you just give it out in small dosages. So a great example, if I'm a good ball player, right? So if I'm a good ball player, and I don't want a girl knowing, how much I make, or I don't want her going on Google and Wikipediaing me, right? So I might allude to her as to say, hey, I play sports, and I might insinuate that I play them at a high level. But I'm not going to, on the first or second date, go, oh, by the way, I play AAA baseball and was on the field for some teams beyond AAA. I was in the majors. I'm not going to say that. Because maybe I want the girl to get to know me and not my career, right? So use that as an example. Don't, use that baseball analogy, that made-up example that I gave to you, and use that. So if you have anxiety, bipolar, or a physical disorder, maybe you've gone through a lot. I know there's a lot of people with physical disorders, and they survive surgeries, and so what I'm trying to get at is, you can allude to, hey, I've had events happen in my life, or, say if you have anxiety, I get a little nervous, or I get a little scared during scary movies. You can do that. You're giving it in small dosages, right? And they're getting to know your personality, and they're getting to know you. They already like you. Quit with this stuff. Quit with this self-doubt, right? And so as they get to know you, then you can kind of tell them more and more and more and more. You know what? In fact, they might want to know more and more and more because they're intrigued by you. A lot of people with disorders, especially the physical ones, they've been through major surgery, just horrific surgeries, and they're just scared. How do I date again? How do I do this? My advice is don't deliver it in a way that that's going to be the main focus. For a great example, I had somebody that, like me, and they had seizures. They walked up to me and said, "Hey, I have seizures." Just like that. "My name's blank. I have seizures." Now I'm sitting there going, I almost started to laugh. Because not because somebody has seizures, but I honestly started laughing because it was just so odd. And that became the main focus that I was thinking. She's got seizures. I had no problem with this. In fact, the reason why I stopped talking to her is because she called me all the time. And that's another reason with people with insecurities. If their insecurities, like OCD or anxiety, rule their life, and they're too clingy, because they'll cling on to every word that you say, every mannerism, raise of an eyebrow, the way you look at them. "Oh, they looked at me a different way. They gave me more attention than a person." That's what they're going to focus on. Okay? You have your own problems. You don't need that. Yeah, you don't need that. The calling, the consistent calling every time, that's what got me. It wasn't the seizures. Okay? And at this time, I was a pretty good athlete. I was in way better looking, way phenomenal shape, talking 7% body fat, and just everything. And I still would have took on somebody with seizures. I'm not saying take on somebody. I still would have prospected of dating somebody with seizures. That wasn't the problem, guys. So I just want you guys to know that that wasn't the problem with me. And I'm going to get more up close and personal for this one. Self-doubt. You are worth something. Okay? You're worth something. If you went through a traumatic experience, you survived something. You're a survivor. There's hurricane survivors. And they get praised. You should too. I'm not saying pat yourself on the back, but I'm trying to say is give some self-worth. You're a survivor. If you went through a horrific car accident, and maybe you have multiple blood transfusions, I'm throwing out examples. You're a survivor. You are a survivor. If nobody has told you that, I'm gonna look straight up and tell you, you're a survivor. You are a survivor. And that same strength that got you through that same strength that got you through that, and here, I'm going to readjust this a little bit. That same strength that got you through that, you need to find somebody that's going to see that strength. So for a great example, you're a survivor, and now you're doing things above what prototypical normal people would do. Somebody's going to see that strength, oh my God. I had a boyfriend that didn't do jack and crap, and they didn't go through half the crap that you went through. They're going to see that as a strength. Women. I know people that you go through a bunch of things. Things that I'm coming off my head, or ovarian cancer. You have to make some crucial decisions when it comes to that. HPV and related to protection in cervical cancer. You guys deal with a lot of stuff. So do men. Guys, I hate to tell you this, testicular cancer happens mainly between 16 and 35. After 35, don't worry, it's your prostate. So, But realistically, so as you age and as you mature, you're going to go through more stuff. Okay? Not one person that I've met has been squeaky clean. I've seen people that are squeaky clean physically, but then they got anxiety disorder. Not saying that's a problem. I would date somebody with anxiety disorder. As long as they didn't control their life. Okay? They have panic attacks here and there. I got no problem with that. I personally don't have a problem with it. But if it rules their life, then yeah, I do. See, it's how you handle your own disorder sometimes. And that's a self-doubt. That's a self-doubter right there. And that's what I'm trying to express to you guys. That is a self-doubter. Self-doubt is right in the word. You're doubting yourself. Self-doubt. Don't do that. Okay? Don't do that. So just like, for a great example, again, as I go into the example, don't sell yourself out. Right? Okay? So, when you meet somebody and you're nervous about having a panic attack, or you're bipolar, or you went through some physical problems, you got scars anywhere on your body, and you're like, how am I going to explain this? This is like the elephant in the room, right? Don't explain it. Give it to them in small dosages. Because if you do explain it, just like if I said, hey, there's a girl with a nice, rack for girls. There's a guy with some nice arms. Look at those arms. Look at that butt. Right? You're gonna look. What I'm trying to say is that becomes the main attention. And the attention should really be on you and your personality. Your looks and your personality. That's why they're there. I'm not saying looks are everything. I don't want to make it come out like that. What I'm saying is that's the reason why they're there. So if you're insecure and you're on a date with somebody, don't be insecure. Don't have self-doubt. You're there because they like you. Right? Or they have other intentions in which you shouldn't even be in that position anyway. So that's my advice, guys, for people with disorders or for people that have problems. I can't cover every single one of them. I can get into detail of anxiety and its mechanisms and what it does, right? But realistically, come out in small dosages. Just like I gave the baseball example. Maybe on the first day, say, yeah, I played baseball at a high level. Kind of allude to it. Maybe on the second date, I was pretty good. Threw 90 miles an hour. Left-handed. It's pretty good. But I had some shoulder problems. Blah, 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 blah. Then get more in depth. So, guys, stop the self-doubt. Stop the self-doubt. Don't do that. Okay? Secondly, small dosages. If you throw it out there again, that's what they're going to pay attention to, right? That's what I would pay attention to. Somebody goes, hey, my name's blah, 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 and I have blah. Or I went through blah. That's what I want to pay attention to. Right? And that totally deviates what I should be paying attention to. So you're not cheating the other person. Right? You're not cheating them, and you're not cheating yourself. Don't feel like, well, because I wasn't upfront with them about everything. No. Unless you got some STD or something. No. It's not unfair to them. It's not unfair to you. Right? It's fair. They're getting to know your personality, your looks, and vice versa. That's my opinion, guys. Realistically. Think about it. Look at that girl's butt. Okay? Well, if somebody goes, I have anxiety disorder. I have immense panic attacks. That's what you're going to focus on. But that could be the hottest girl with the sweetest personality that is humbled by her experiences and can treat you like gold. There could be a guy out there that's been through a car accident, lost some organ here and there. But they could treat you like gold. That's what I'm trying to get at. So you guys that can treat people like gold, you're worth something. One, you're a survivor. You survived something. Wasn't a hurricane. Wasn't highly publicized. You probably weren't in the newspaper. You survived something though. So I'm going to tell you, you survived something. Okay? You survived. That's the important thing. That's what I want to get to you. And the self-doubt. Right? Stop with the self-doubt. Doubting yourself. You're shooting yourself down before you even attempt anything. Right? So use that baseball player again. Maybe he said, I wasn't good enough to play in the majors. He'd never make it in the minors. Never. Right? Never. Kids at home. You're trying to gain some weight. Right? Maybe you're undersized. Maybe due to a health condition. Maybe you have a hyperthyroid. Right? They fix your thyroid problem, but you're still undersized. there's ways that you can build muscle. There's ways that you can do it. Right? Testicular cancer has a high success rate. Happens between 60 and 35. You can survive it. Guys, you are a survivor. I'm going to say that again. You're a survivor. You've come this far. Don't go that far. Stay within yourself. And when you're talking, because sometimes we're all in our head, take a deep breath. And just tell a girl what you want. Tell a guy what you want. Right? There's three areas. 3. Either you want to fill somebody out. No problem with that. Right? 2, you want to get to know them more. 3, you want to date them. Let's start with the bottom one, filling somebody out. Maybe one of the guys' biggest defaults that I've seen. Being in college and at bars and, one of the biggest defaults, and women too. They're looking for something, but they're filling people out. The problem is, those girls that you're filling out, they're going to be gone in 3 weeks. Right? It's just as simple as fact. They're going to be gone. Because somebody else is going to want to get to know them more. So it's okay if you're filling people out. But if you get to that point, that second level, where you want to let a girl, you want to let her know that you want to get to know her more. You don't text her or type her, I want to get to know you more. Simply go, hey, Saturday night, you want to go out to a movie? And women, some guys are really passive. Let's face it, guys. This is the 2000 teens. Right? Like one girl asked me, hey, were you going to ask me out this weekend? Because we had to go, and I was like, yeah, actually I was. Do you see what I'm saying? She was letting me know that she was interested in knowing me more, and I reciprocated that. See? And then when you get to the third stage, right, so you got to know your intentions. You got to go, what is it, sorry for my collar being weird, but what is it that I want to do? What is my intention behind this text message? Do I just want to fill her out? Or do I want to get to know her more? Right? You got to let her know. And women, you got to let them know. In particular men, though. Because it's still more chivalrous for a guy to make the first move. Right? So guys, you got to really know what you're doing behind the messages. Because all these girls are all in their head. Right? Does he like me? I don't know if he likes me. He smiled. He gave me more attention. Let it be clear. And the third, once you want to date the girl, once you've gotten to know her, it'll be simple. She likes you for your looks, your personality. You've gotten to know each other more. And obviously, if you have any health conditions or any other thing, at this point in time, she'll probably know or have a really good clue if you haven't told her. If she's still sticking around, guys, or girls, if he's still sticking around, probably likes you. Right? So you gotta know what levels you're on. If you're just in a fill it out stage and you're like, oh, I'm not getting to know these people better, well, guess what? It's because your message is not clear. You got 3 intentions of text messaging somebody. And just breathe in deep inside yourself and just go. If you don't know what it is, like some guys will just panic and just go, I don't know what to word it. I don't know how to word it. Or they'll call, or with Facebook, everything's so instant, right? And they don't know. Just take a deep breath and go, what is it that I want to tell? What is it that I want to tell him or her? Okay? I want to go out on a Saturday date. Write that. Right? Write it. Write it. Saturday. Hey, Saturday. Want to go on a date? Don't go, I'm so insecure, I don't know if she likes me, blah, 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 blah. You'll find your answer. And don't go with all this self-doubt and all this, I have anxiety disorder, or, I have this, I have that, people with, digestive issues, people with, all these types of issues. Take care of yourself first, but don't undersell yourself. Seriously, don't do it. Don't do it. You've been through enough. You are a survivor. And the other 3 examples that I gave, filling out, getting to know it, dating, that goes with everybody. Right? You know, at one point in time, I was the man on campus. You know, walking around, you know, But I realized something. Sometimes I was just filling people out. It's when you get to know them more. They reciprocate. Typically, that's the best. Once you made that level, you'll get to know more things about yourself than you ever knew. Trust me, you will. Ask a lot of married couples how they got together. You will. Made this a long video, cut it short. That's it.